Okay, sorry for that little break. So we were talking about preventing contamination of an enteral feeding. So we said replace the feeding equipment after 24 hours, replace the feeding tube according to the manufacturer's recommendation or the agency's policy if that is sooner. Store open feeding solution in the refrigerator in a covered and labeled container. Allow the solution to return to room temperature before giving it to the patient. And anything that is over 24 hours old should be tossed. Keep unopened solutions at room temperature. Never allow a feeding to hang below the level of the patient's stomach. Follow the agency's policy regarding how long a solution may be left hanging. Remember, if it's an open system, it's going to be 4 hours or less. Non-sterile feedings may hang for up to 4 hours or unit policy. Do not transfer sterile feedings into a secondary container. Only use the container that it came with or that it's for that purpose, and not moving feeding from one bag to another. Use sterile water for flushing, unclogging, or immunocompromised patients. Otherwise, tap water is used. Okay, so we're to the AWARE, which was what you do to practice safe medication delivery. This is on page 975 in your book. So, you ask the pharmacist if there's any drug-to-nutrient interactions, any drug-to-drug interactions, any adverse drug reactions. Drugs can clog the tube and use water only to dilute the medications. Routinely flush before and after, and use water only. Administer medications one at a time. Do not add medications to formula. Identify medications that must be separated. All medications must be given one at a time. Remember the rights: the right patient, the right drug, the right dose, the right route, the right syringe, the right drug formulation, the right dilution, the right tube, and the right medication port. Follow your facility's medication protocols. Establish specific enteral medication protocols based on national guidelines. Practice recommendation. There is a website, www.nutritioncare.org. Okay, how to check the feeding tube placement. Remember that the feeding tube must be verified by X-ray before the initial feeding can be given. None of the bedside methods is foolproof, so you always should use several of these following methods. Use the pH measurement in combination with one or more of the following. So, once the tube is placed, you would use clean gloves and instill 10 to 30 milliliters of air. You want to aspirate stomach contents, 20 to 30 milliliters approximately stomach or intestinal juices. Inspect that aspirate. Gastric contents are normally greenish brown and liquid. If they're receiving formula, it could be white in color and it could look curdled. If you're getting in intestinal contents, it will be yellow and no curdling. Measure the volume and pH of the aspirate. The pH should be 1 to 5.5. We measure and observe the length of the tube that extends from the body. Injecting air into the feeding tube is no longer recommended. This is the least accurate method. Ongoing patient assessments. Observe for respiratory distress, any cyanosis or difficulty breathing or coughing or choking. Assess whether the patient can speak. And then there was a method listed in your book called capnometry, which measures carbon dioxide concentration in expired gases. And then you need to know what else your facility may have in place. And this is found on page 980 to 981. How to check that the tube is properly placed. So before I go with medication administration via the tube, some of the nursing diagnoses that you might be able to use: nutrition less than body requirements related to inability to intake sufficient nutrients, or diarrhea related to decreased tolerance of enteral feedings. Okay, so medication administration via the tube. This is listed as a procedure on page 830 to 831. You have to prepare the medication. So let's start with, let's say you have a liquid medication. So you're going to get your liquid medication poured, and remember, if it's less than 10 milliliters, you should be pulling it up with an oral syringe. Then you're going to put on a pair of non-sterile procedure gloves. Put the patient in a high Fowler's position, sitting upright. If it's an NG tube, we're going to check the placement. Check the measurement where it goes into the nose. Measure the length of the tube from the nose to the end. Check the aspirate. What color is it? What is the pH of it? Does the patient not seem to be in any respiratory distress? Does it seem okay? So then we're going to check the patient for residual volume. And remember, if you're using a irrigating syringe and it holds 50 milliliters, the patient may have more than 50 milliliters in their stomach. So you would draw that back, and then you would squirt it into a styrofoam cup or into the irrigation kit container and keep pulling back until you don't have any more residual, and total all of that up, and that's your residual, and then instill all of the residual back into the patient. You always flush first, so flush the tube with 20 to 30 milliliters of water. Remember, you may need to use sterile water in certain situations. Instill the medication by gravity, so into the syringe. It's a 50 milliliter syringe. So you're going to pour the medication in, let the medication run through, and then flush with the water. So you flushed with 20 to 30 milliliters of water. You can do that by gravity also. And remember that the tube needs to be filled with fluid, or it needs to be shut off so that the patient's stomach isn't sucking air from the environment into the tube. Flush with the water, and then you're done. And the patient should remain upright for at least 30 minutes to minimize risk for aspiration. If you're giving more than one medication, you would give medication, flush, medication, flush, medication, flush, with a flush at the beginning and flush at the end. And then you have to keep track of all those flushes, and you want to total those up. So if you're giving 3 meds, you're going to flush 20 at the beginning. 20 would be the medication, flush with 20. Give the second medication, 20. Flush with 20. Third medication, 20. Flush 20. So that would be a total of 140 milliliters of fluid. And you might have to be cautious if your patient is on a fluid restriction. So now what if you have a pill that you have to crush? So before you would crush any medication, you have to make sure that it's okay to crush that medication. So it may tell you in your drug book, you may have to have a consult with the pharmacist. You should know that anything that's enteric-coated, long-acting, controlled release, anything that has beads that won't kind of melt into a solution when you crush it. So if you had a pill, it would be real easy to crush that pill and mix it with 20 milliliters of water. And you're going to take that medication and make it into a little solution with pill and water. And I would prepare each of your medications that you have to give. So let's go back to the situation where there's 3 meds. So I'm going to crush the pill. Let's say one medication is liquid, and then I'm going to crush the other medication. So I've added 20 milliliters of warm water to a medicine cup, and I've crushed the pill, and I've stirred to make sure that the pill kind of goes into solution. So when we're ready to give those medications, we first have to verify the tubes in the correct position. So we're doing that step. We're checking residual before we give the medications. Then we're going to start our procedure. We have on clean gloves, and we're going to flush with 20 to 30 milliliters of water. Then we're going to give that first pill that we crushed, and we're going to pour that into the end of the syringe. Then we're going to flush. Then we're going to give the liquid medication, and then we're going to flush. Then we're going to give the next medication that we mix up in the cup, 20 milliliters of water, crushed pill, mix up, mix up, mix up. We're going to make that into a slurry and run it into our syringe. And then flush at the end. And then it's most important that the patient has to remain upright for at least 30 minutes to minimize the risk for aspiration. And remember, if they have this tube, they should never be lower than 30 degrees. They should always be 30 degrees or higher. And that, again, is a measure to take to prevent them from aspirating. Okay, so this followed along right with the book. I hope that you got everything and that you appreciate me giving you the material in this way, and I hope that you find it helpful. So the most important takeaways are how to check for residual, how to check for tube replacement, and that the tubing and the feeding container tubing stuff, that gets changed at the appropriate times to prevent infection. And we check residual so that we're not fluid overloading the patient, and we check placement. To the best of our knowledge, the tube is in the correct place before we would give any feeding or medication. And if they're on continuous feeding, every 4 to 8 hours, you're checking to make sure that that tube, that you measure from the nose to the end of the tube, that you check the pH, that you look at the color of the aspirate, you assess the patient, and you document to make sure that the patient is in 30 degrees or higher, and that the patient doesn't have any respiratory symptoms. Okay, that's all. If you have any questions, please feel free to email me at sheppal@scc.losrios.edu, and I'll get back to you as quick as I can. Thank you.